Please join me to welcome Dr. Pars. Thank you for the very generous introduction, and I'd like to thank the organizing committee for the opportunity to be here. It's both a pleasure and honor to be at this meeting. We're back in Turkey. I have many friends in Turkey. It's nice to reunite with them. So I'm going to talk to you this morning in the time available to me is about exercise as good medicine. That's really something that I don't need to tell this group because you're committed to this notion. And everyone here knows that there are many, many benefits of exercise, and some of those are listed here. And that is that if one exercises on a regular basis, that you have reduced risk for high blood pressure, type 2 diabetes, heart disease, stroke, and all-cause mortality. But you all know that, so you didn't come here to hear that. So what I'm going to talk to you about today are some things about exercise that perhaps you don't know as much about. So in the next few minutes, I'm going to take you on a road trip. And along the way, we're going to have 3 stops. And in each stop, I'm going to tell you a different, what I think is a unique story about the benefits of regular exercise. And in our first stop, we're going to talk about the fact that regular endurance exercise has been shown to protect the heart, not only against having a heart attack, but when someone experiences a heart attack. The second stop along the way, I'm going to tell you a story about the importance that exercise can reduce the damage associated with chemotherapy for treatment of cancers. And the final stop today is a stop that I don't actually investigate in my laboratory, but I think is extremely fascinating. And it has to do with the possibility that regular exercise might cause a browning of adipose tissue, which could have some very, very positive health benefits. And this is an emerging story that I think we'll have some fun with. So with this big picture introduction, the roadmap, where we're going to go, let's get started. The first stop along the way is something I call the exercise-induced cardioprotection story. Everybody in this room knows that a heart attack is damage to the heart that results from an event called ischemic reperfusion injury. And the significance of this, of course, is that this is the greatest cause of morbidity and mortality associated with coronary artery disease. And heart attacks kill a number of people all over the world. And recent estimates by the World Health Organization estimate that over 7.4 million people die annually from a heart attack. And many people think this number is an underestimation because of the failure to report all of these deaths. But clearly, if one experiences a heart attack, the key to survival and recovery is to minimize how much damage actually occurs to the heart during this event. And so when I talk about during this first discussion, the term cardioprotection, what I'm talking about is protecting the heart against ischemic reperfusion injury. So what happens during this kind of event to damage cardiac cells? And this is important to understand because this allows us to develop a strategy to try to protect against this. And of course, the first event is a blockage of the blood vessel. Many times, and most commonly, this is likely a thrombotic event, a blood clot forms. And when this happens, this results in reduced blood flow distal to the clot, resulting in an area of the myocardium that's at risk for damage. And what occurs during the ischemic insult is a cascade of events resulting in increased production of free radicals, calcium overload in the cell, activation of calcium-activated proteases like calpain, an increase in hydrogen ion, a decrease in ATP, resulting in potential damage to those cardiac myocytes that are at risk. When the clot breaks down and the heart's reperfused, ironically enough, this problem is acutely exacerbated during reperfusion. That is, there is a further increase in radical production, a greater exacerbation of calcium overload, further activation of proteases and damage, and collectively, during ischemia and reperfusion, mitochondria, the powerhouse of the cell, are damaged, and ultimate cardiac injury occurs. How much damage actually occurs to the heart during this kind of ischemia reperfusion insult is directly dependent upon the duration of the ischemic event. And conveniently, we can think about the level of injury that occurs in the heart during a heart attack into 3 levels based on the duration of ischemia. The lowest level occurs if the ischemic insult is 5 minutes or less. There's no frank cell death, no infarction. There's no stunning of the myocardium, that is depressed contractile activity, but there certainly is arrhythmias. And arrhythmias are not trivial because ventricular arrhythmias are the greatest cause of death acutely during myocardial infarction. If the ischemic insult extends beyond 5 minutes, up to 20 minutes, you still have arrhythmias, but there's a stunning myocardium, that is a contractile dysfunction that persists for typically 24 to 48 hours. But most hearts completely recover from this. But the real problem begins after 20 minutes of ischemia. And this results in frank infarction, cardiac cell death, and it's unlikely these cells will ever be replenished, and so these cells are lost forever. So you're well aware of the fact that human epidemiological evidence suggests that people that are physically active have a better chance of surviving a heart attack. But the problem with using this epidemiological evidence as proof is that many people that exercise on a regular basis also practice other good health benefits, healthy lifestyle, and this may actually contribute to this protection. So it takes animal experiments to demonstrate whether or not this actually occurs. And so over the next few minutes, I'd like to try to convince you that based on animal experiments, that exercise is really a powerful tool to protect your heart against the insult of a heart attack. The way these experiments are done typically is rodent models most commonly used in the laboratory. And there are typically 2 modes of exercise that are studied. Endurance exercise that commonly these animals run on treadmills or run freely on wheels. And recently several resistance training models have been used. And the sedentary model, of course, is the caged animal that isn't allowed to exercise, much like the lifestyle that most human beings live, certainly in North America, I can attest to that. And so, a number of years ago, we did a series of experiments where we exercise trained animals on a regular basis, 5 days a week. They ran for 60 minutes a day at about 50% of their VO2 max. We exposed the heart to a short ischemic insult, 15 minutes, that would result in myocardial stunning. We used as a dependent measure the left ventricular developed pressure. This is an index of how well the heart's working. And you can see that sedentary animals exposed to this rather mild heart attack suffered a significant decline in cardiac function, but those animals that exercised for 10 weeks marked protection. Well, surprisingly, 3 years later, Dr. Heider Emerald demonstrated it doesn't take 10 weeks of exercise. And in fact, 5 consecutive days of exercise results in essentially the same level of protection that you get in 10 weeks, indicating that the benefits derived from endurance exercise, at least in the heart, happen very, very quickly. So you're probably wondering, okay, this is protection against the rapid mild heart attack. 15 minutes of ischemia. What happens if you're faced with a really severe heart attack? It's a great question. I'm glad you asked. We did these experiments shortly thereafter. The heart was exposed to 60 minutes of ischemia, massive infarct. And what's shown here is the percent of the risk area that was actually infarcted. And you can see in sedentary animals, 60% of the heart that was at risk was infarcted, a massive heart attack. But contrast this to the exercise training group. Tremendous protection. Less than 20% of the risk area is actually infarcted. This makes a huge difference in the outcome. Undoubtedly, these animals, if they'd been allowed to live, would have gone into heart failure because of this massive infarct. It's likely these animals would have recovered, function well, and if they could resist another heart attack, go on and live a long lifespan. So one of the questions that arises, all of these experiments that I've shown you at this point have been in young, healthy animals. What happens if you endurance train senescent animals, because obviously the risk of a heart attack increases with age in human beings. That's another great question. John Quindry in our laboratory did those experiments, and long story short, he demonstrated that senescent animals exposed to endurance training also were protected, indicating that not only young animals are protected, but senescent animals are also able to achieve the benefits of prolonged endurance exercise. So the question that people ask us consistently is, well, do you derive better benefits if you train at higher intensities? So to address that question, we did a very simple experiment where we exercise trained animals at either 50% of VO2 max or a much higher intensity, 70%. We exposed the heart to ischemia and reperfusion, and what the results suggested was really no great benefit of higher intensity. And so the good news here is that it appears that relatively low levels of physical activity, only 50% of VO2 max, provides the same level of benefit that you get at a much higher intensity. Well, what about resistance training? You only get this benefit to the heart if you engage in endurance training. There's not a great deal of data on this, but there are two experiments from the same laboratory that used a rodent model of resistance training where the animals simply, with positive reinforcement to get food treats, exercise their lower legs. And this is exercise that's not extremely intense resistance exercise, because once the animals get satisfied with food, the exercise session is over. And there's not a lot of hypertrophy. But these investigators demonstrated that 4 weeks of resistance training using this modest stimulus didn't provide protection against ischemia reperfusion injury. But if you extended the training period out to 12 weeks, there was indeed modest protection, suggesting that resistance exercise also has some benefit to the heart against this kind of insult. So the final question I'd like to address, and this was an issue that people would ask me when I give talks about this, is it terrific? You've convinced me that regular exercise protects the heart, provides cardio protection against even a massive infarct. But what happens if I stop exercising? Well, to address that, Shannon Lennon in our laboratory did a very simple experiment. She exercised trained animals for 5 days, stopped the training, exposed the animals to ischemia reperfusion in either 1, 3, 9, or 18 days after cessation of training. What we found was rather straightforward, plenty of protection up to 3 days. It appears that the level of protection starts to go down at 9, but it was still significantly protected compared to control. But by 18 days, all the protection is gone. So much like the other benefits of exercise that we're well aware of, this doesn't last forever, and protection leaves, at least in a rodent model, within 18 days after your last bout. So the intriguing question is, how does exercise bring about this protection? What are the mechanisms responsible for this? So if you look at the big picture of the biology of the cardioprotective phenotype, logically several changes might explain this. One change on the vascular side could be that you could have anatomical changes where you have angiogenesis, collateral circulation that might protect during ischemia, reperfusion, insult. You may have changes in endothelial function that allows the coronary vessels to reperfuse more quickly during the reperfusion phase. And both of those, or a combination of the two, could provide the cardio protection. It's also possible that you have direct changes in the cardiac myocyte itself. That is, the cardiac muscle fibers themselves are intrinsically protected, and you can have some combination of the two. Experiments have demonstrated, though, by isolating, these are cardiac myocytes isolated from the left ventricle of an exercise-trained animal that are exposed to a simulated heart attack, that is, hypoxia and reoxygenation. And these experiments demonstrate that the cardiac myocytes themselves are very protected. This doesn't negate the possibility that there are vascular changes, but it does demonstrate directly that much of the benefit is derived in the cardiac myocyte. So what's happening in the cardiac myocyte? How do these changes take place? Well, of course, we think that this is a signaling cascade that, in response to the stimulus of exercise, is activation of signaling pathways, increased expression of key proteins that may be cardioprotective, and of course, there may also be post-translational modifications of proteins that play a role. And so what are these mediators of cardioprotection? Well, if they're going to be a mediator of cardioprotection, you would predict that the molecule is going to do something to reduce these negative events that take place during ischemia reperfusion. So what particular candidates might explain this? And this is my list that I call a list of all the usual suspects. There have been experiments that have suggested any one of these factors alone may explain cardioprotection. Time doesn't allow me to go through the evidence that shows support or denial of all of these, so I'm going to give you a quick answer. And in my opinion, all of these mediators that have the X, I don't think are essential for the exercise-induced cardioprotection. Exercise might, however, alter a specific type of potassium ATP channel located on mitochondria or the sarcoplasmic reticulum. We're not sure about that. That remains to be determined. But I am confident that evidence indicates that exercise-induced changes in mitochondrial antioxidants probably play an important role, and it's also very likely that exercise-induced changes in opioid receptors, they play an important role here as well. So I'd like to summarize the major take-home messages for part one of my story. And the major message that I want you to remember is that exercise is really a very powerful mediator of cardioprotection. But exercise is also only good if you continue to do it. This is not a sustained benefit. If you stop exercise, this protection is rapidly lost. It seems likely that the mechanisms to explain this cardioprotection is likely multi-genetic. There are multiple factors that likely change that provide this powerful protection. And I think these kind of experiments point out the importance of studying exercise, that it's a valuable tool to develop therapeutic interventions for a variety of different disease disorders. So I'd like to shift gears now and move to our second stop on our road trip. And that's to talk about the importance of exercise of protecting the heart and skeletal muscle against the damage of chemotherapeutic drugs. So the drug I'm going to talk about in particular is a prototypical chemotherapeutic drug called doxorubicin. Many of you may be familiar with this drug. It's widely used in cancer therapy. It's a very effective drug against a variety of different types of cancer, but it has a serious downside, and it has really very serious cytotoxicity effects, and that is, it contributes to the cell death of cells other than tumor cells as well. And here's some evidence of this. This is actually studies, clinical studies in humans, and what's shown here is the cumulative dose of doxorubicin expressed milligrams of the drug per square meter of surface area of the individual that's treated. This is the risk of heart failure. And you can see that regardless of the age of the individual, there's a cumulative dose of doxorubicin that the risk of heart failure increases exponentially. And unfortunately, the risk is higher in older people. And that's unfortunate on several levels, but older people are at greater risk for cancer, of course. And so more cancer patients are older. But the point is, although this is a very effective drug against the neoplasm, it also is an extremely toxic drug in terms of heart failure. So why does doxorubicin cause this problem? Well, that's complicated, but a simplistic part of the story is that it's well known that doxorubicin in our cells causes the powerhouse of the cell, mitochondria, to produce radicals. This results in cellular damage to organelles, to proteins, even the DNA, and ultimately can result in cell death. So it stands to reason that if you can protect normal, healthy cells, that is the mitochondria, against this damage, then you may be able to reduce the toxicity of doxorubicin. So when you think about what exercise does to the heart and skeletal muscle, this is potentially an intervention. We all know that exercise causes an increased mitochondrial turnover and biogenesis of mitochondria, making new mitochondria, so at any given time, in exercising the heart and skeletal muscle, you're likely to have a healthy population of mitochondria. This also is associated with exercise-induced improvements in antioxidants that might protect against the radical production, and you have an increased level of stress proteins that may also protect the cell. So with that reasoning, people started to do experiments using endurance training as an intervention while animals were being treated with doxorubicin. And one of the first experiments to demonstrate the benefit of the transition of white fat from browning to beige or to bright. So why are we interested in this? Well, over 20 years ago, a paper published in Nature suggested that animals that have complete ablation, genetic ablation of all of their brown fat cells become obese and develop diabetes. 3 years after this, another paper from the same group demonstrated that if you just decrease pharmacologically the brown fat, you don't have to think at all about it, just decrease the amount. This greatly increases the risk of obesity, diabetes, and hyperlipidemia. But this idea got sort of lost sometime after that, so it was almost a decade before additional work was done. And the first work that clearly demonstrates that exercise has an impact on adipose tissue is shown here. This was published 3 years ago. And what they demonstrated is that in regular endurance exercise fostered browning of normal white adipose tissue. You can see other picture, there's an increased browning. This is a measurement of that coupling protein that I mentioned earlier, UCP1, which is a biomarker of brown fat cells. And you can see a marked increase with exercise training, suggesting that exercise might cause a transition of white adipose cells into brown, or something in between the bright or the beige. So how does this occur? Well, this is a huge debate right now. There's a great controversy. But one of the original ideas was that one of the myokines, the exercise-induced hormone release from skeletal muscle called irisin, would be released into the circulation, active on receptors in white adipose tissue, and perhaps even beige tissue, to increase the browning. Now this again is a huge debate, but what people do believe is very good evidence in animals that this occurs. So the question is, if you increase the amount of brown adipose tissue, does this actually have improved glucose homeostasis and energy balance? In other words, is it feasible that exercise causes this browning and has a positive benefit? Well, one of the ways to study this is to do a simple experiment where you transplant brown fat. And this is the experiment I'd like to describe to you. This is a group at Harvard University in the US. And they had two groups of experimental animals. Both were fed a high-fat diet. Both maintained a sedentary lifestyle, much like the couch potato of North America. In one group of animals, they surgically transmitted a small amount of brown adipose tissue, subcutaneously. This transplantation then was allowed to the animals to recover from the procedure, and they did a glucose tolerance test. And of course, this high-fat diet resulted in obesity. These animals developed type 2 diabetes. So you can see the animals that were on a high-fat diet without the brown fat transplantation started with resting blood glucoses that were twice normal levels, so they were truly diabetic. The animals that were on a high-fat diet, sedentary, but with brown adipose tissue transplantation, had normal resting glucose. And when they consumed the bolus dose of glucose and the glucose tolerance test, their clearance was just like a healthy individual, indicating that independent of exercise, still obese animals, but with higher levels of brown fat, they were protected against hypoglycemia and diabetes. Well, what about their body fat? Miraculously, in a short 6-week period, these animals with the transplantation lost body fat, indicating that brown adipose tissue aids in energy balance and actually causes them to lose weight. So what we think is going on here is that exercise causes a brown white adipose tissue, labeled here as trained white adipose tissue, that on exercise, perhaps these release adipokines, which are hormones released from fat cells, and perhaps these have a positive benefit on glucose clearance and energy balance around the body. So this is exciting news, I think. This happens, and this is something to keep your eye on, because this is going to be important news. So the temptation for all of us to become couch potatoes is great. This is an example of two floor potatoes, two dogs that are resisting the temptation to go outside and play. But we all have to tell ourselves that the benefits of exercise are vast. We have to lose this urge to be sedentary, get outside, go for a walk. An ocean is good. If you don't like exercise for exercise's sake, find a sport that you like to do, play this sport. But regardless of how you choose to exercise, we all need to do it on a regular basis, and regardless of the way you choose, your heart's going to love you for it. So I'd like to briefly summarize the take-home messages here. We reached the final destination. I know you're very thankful for that. But these are the messages I'd like to leave you with. What I've told you this morning is that I think the evidence is extremely powerful. Regular endurance exercise and perhaps resistance exercise can provide profound protection of the heart, not only about reducing the risk of having a heart attack, but reducing the damage that occurs during ischemic perfusion injury. I've also shown you evidence that I think is very convincing that exercise can reduce the risk of cardiotoxicity, skeletal muscle toxicity that's derived from chemotherapeutic agents like doxorubicin. And I also think that there's a lot of excitement about the possibility that exercise might cause a browning of right adipose tissue. There's limited evidence in humans that this actually occurs. Experiments are just now being done. The evidence that's out there is mixed. But this is a very exciting possibility. This is one of the major benefits of regular endurance exercise. That is a beneficial change in white fat cells that normally can create significant problems by releasing inflammatory adipokines that we know that are associated with many chronic diseases. And this is an exciting time, I think, to be involved in encouraging physical activity worldwide. So with that, I'd like to thank all of you for your attention.